Transverse myelitis is a condition. It is also known as monophasic condition in which there is disorder affecting the spinal cord, and demyelination results into inflammation of the cord and loss of transmission of the signals of the nerves. It occurs because of inflammation of the myelin, fatty substance surrounding nerve sheath that damages and results into the tingling sensation and loss of transmission of the signal, that is known as transverse myelitis. So there is a clinical triad of transverse myelitis, that is motor weakness, sensory level numbness, paresthesia, and sphincter dysfunction like urinary retention, bowel dysfunction, and sexual dysfunction. So this is the triad of transverse myelitis. There are signs and symptoms like motor, sensory, and autonomic signs and symptoms. Weakness below the lesion, flaccidity, and hyperreflexia with Babinski sign. Hallmark sensory level block, pain in the back, lower back pain and temperature, bladder, urinary retention, bowel dysfunction, and orthostatic hypotension is there in the transverse myelitis. Because of demyelination, there is severe weakness and initial lens-setting pain, spinal shock, and sensory disturbances at the level of cervical vertebrae is there. So management is through MRI. It is investigation of the choice, and then CSF culture is performed. Oligoclonal bands are absent in transverse myelitis. Treatment is high dose of methylprednisolone, and other variable patients develop multiple sclerosis in latent years. So transverse myelitis is demyelination disorder of spinal cord at cervical level, results into these type of presentations. Okay, next one is multiple sclerosis is chronic remitting relapsing autoimmune demyelination disorder and destruction of myelins and oligodendrocytes. Risk factors is a female, gender, history, family history, HLA-DR2 associated, and 40-year age can be affected. Vitamin D related, cold climate, sun exposure, or Epstein-Barr virus. So these are some of the common risk factors. And pathogenesis is there is early onset CD4 cell reacts against myelin basic proteins, results into damage, and that cause damage of the myelin sheath.